I'm a nephrologist by training, and so we're interested in kidney disease, specifically diabetic kidney disease. And as part of that, we've been interested in why kidneys fail. And specifically, we're interested in the uptake of lipids, fats by the tubule cells of the kidney. And so we think this is important for diabetic kidney disease progression. At one point, we made a mouse that had this fatty acid transporter knocked out, and it appeared that that was beneficial for kidney disease. And so that led us to consider the possibility that there could be small molecule inhibitors that would behave the same way as knocking out the gene. And so we did some preliminary work, mostly in silico screens to look for compounds which we began to test in cells in culture. So right now, I think we need to find molecules that are even more specific and can inhibit this fatty acid uptake process at even lower concentrations. And again, that can all be done with cells in culture. And once we've achieved that, then I think it's ready to be tested in animal models, specifically some of these diabetic kidney disease animal models that we've maintained all along. The work that led up to this was in collaboration with a PhD scientist in pharmacology at Case who died unexpectedly. So I lost a partner in this drug development project. And I wasn't so sure that the project would survive. And then when I began to look into the Harrington Discovery Institute, I realized that they could help. They're not going to replace my friend, but there are people with skill sets that could help to replace that and complemented what I do, that would allow the project to be successful. And so, to me, the big bonus has been the in-kind support that they provide, the team that they thoughtfully put together to address what my needs were, namely a project manager, a medicinal chemist, and a pharmacologist, toxicologist. If I had to pay the salaries of those people to help in the ways that they have thus far, I probably couldn't afford to do it. So it's been terrific that they put that team together, for me. And those are my immediate needs, but I can also appreciate that there are people at the Harrington Discovery Institute that have other skill sets that could be useful to me in the future, depending upon how this initial phase goes. Most of us were trained to take care of patients, and we try to do that well, but this goes well beyond that, and I think we often don't know how to do that, so that the help that they are able to provide, I think, is instrumental.